County Health Department. Thanks for joining us. Today we have with us Nita Ludwig, the Administrator of the Rock Island County Health Department, and Ed Rivers, the Director of the Scott County Health Department. In addition, we are bringing in local emergency management providers to talk about the impacts of COVID, the impacts of increasing number of COVIDs on EMS services. We have Linda Frederickson, the Executive Director of Medic Ems, and we have Travis Noyd, the Deputy Chief of EMS for the Moline Fire Department. Nita, let's start off with Rock Island County's numbers, please.
Good afternoon. Today, Rock Island County Health Department is reporting 20 new cases of COVID-19, and that brings our cumulative total to 1,285 cases for Rock Island County with 30 deaths.
Today, our Department of Public Health reports 1,203 cases for Scott County. Our deaths remain at 10. In addition, we're advised that the Test Iowa location in Scott County will continue through the end of the month and may possibly be extended. The volume there remains good, which is a criteria for extension.
Thank you. Next, we are going to hear from Linda Frederickson with Medic EMS. So go ahead, please, Linda.
Am I unmuted? Can you hear me? Sorry.
Yes, we can hear you.
Okay, great. Thank you very much, Brooke. We launched the pandemic protocol in our dispatch center in mid-March, and we have always screened callers for signs of any respiratory or any type of fever-related illness, so we can alert our EMS providers and fire departments of the need to take additional personal protective precautions. We've done that since 2008. We changed to something called the pandemic protocol in mid-March, and we, initially saw some, increases in what we're calling isolation alerts, which is, requiring our personnel put on extra protective eyewear, face shields, even some impermeable gowns. What we're noticing, though, we noticed that as, we all stayed in and we didn't go out any more than we absolutely had to. Now that our states are opening up a little bit more, I know Iowa really opening up in June, we're seeing a definite increase in that. We have had 980 isolation alerts called by our dispatch center since March 1st. And of those, we can tell you that we have confirmed positive of 66 patients who have been positive for COVID-19. We have noticed that probably 33% of those patients have been transported in the first 15 days in July, so we can definitely see an uptick. So we're really, really encouraging people to make sure that they don't go out unless they absolutely have to. They practice social distancing of at least 6 feet. They wear masks or face coverings, very, very critical. We require that of all of our personnel. We are putting masks on all patients, not just patients who we're suspicious of having COVID illness, and just to stay home when you're sick. The days of coming to work when you have a cold are over. So that's kind of the message I have today, is we're definitely seeing a rise in that.
Thank you, Linda. Next, we're going to hear from Travis with Moline Fire Department. So please go ahead, Travis.
Yeah, thank you, Brooke. So much of what Linda said, we've been doing the same thing over here on the Illinois side. Our numbers and volume compared to what Medic transports is obviously not the same, but at the beginning of the pandemic of the issue, we saw about the same. We've transported about 18 confirmed COVID patients, and a majority of those came in like April and March, and then we haven't had as big of a resurgence as far as number-wise. For us, a confirmed COVID transport for the month of July is only one so far on the Illinois side. But again, the numbers are going to be sparing just because of the call volume. But percentage-wise, it's only about 5% of the amount of transports that we've had. As far as what we're doing to protect ourselves and the patient, we're doing much the same thing as Medic is. We don't have the isolation protocol that they have, but we do have our dispatchers asking some more of the questions that you ask of your COVID patients a little bit earlier in the call. So we kind of had them change the order of how they ask their questions, and then they give us a heads up that, you know, there might be some reasons to use extra precautions for these patients. A couple of the other things we've been doing differently is if a patient's able to make it to the door, we ask them that maybe they could meet us at the front door or on the porch or something like that, trying not to enter into a enclosed environment as much as possible. But then again, obviously we're protecting ourselves with surgical masks, gloves, eye protection, face shields if necessary, and even gowns if we have to go to that point. We found that early on that we were advised by our EMS source system to go ahead and even put a surgical mask on the patient if they were able to tolerate it. You know, placing a nasal cannula on their nose and then maybe putting a mask over them to help protect our providers a little bit better. The use of N95 obviously is not as effective unless you have proper fitting, so that's been difficult for us to get that the fittings done appropriately. So we're still working on that. But again, we've been doing the surgical mask and just basically assuming that everybody that we're transporting is a possible positive COVID-19. That's about the best way you can do it. We have a program on our computer for our charting that's asked, you know, was the patient suspicious for COVID? And it's kind of funny when you see your medics click no, and then I get a phone call a day later saying, you know, this patient that you click no on is positive. So it's just been our way of handling it, that we just go into everything, kind of like bloodborne pathogens. Everything is contaminated, and that's the way we're going to treat it. Now, with that being said, we do burn through supplies much quicker by doing that than we would like to. So, you know, that is a concern. You know, the EMAs no longer are providing surgical masks. We can't get any through our regular distributor just due to breaks in the supply chain. Trinity was providing us with masks. So now we're kind of get to the point now that we've kind of hit this little bit of a resurgence. Our call numbers are coming back up. I'm sure Linda saw it over on the Iowa side. Back when this all started, people were staying in the house. People weren't getting out. We would have days where we'd have single digit call numbers. And now we're back up to the 20 to 25 calls a day for EMS calls. And for us, that's busy for the size of the town that we're in. So we're seeing the increase in calls, and again, that means increase in PPE. So we're going through things a little bit quicker, even though we may not have as many positive transports. So we're seeing some difficulty with that. And, you know, just to reiterate what Linda said, you know, if people just, if you're sick, you know, stay home. We have our employees do twice daily temperature checks, you know, and they kind of fill out a little questionnaire. You know, hey, do you feel sick? Do you have sore throat? You know, and we're just asking those basic questions. And if you're not healthy, you know, you need to stay home and protect the workforce and even your family. You know, make sure you're doing what's good for everybody. So that's kind of what we're doing here. Again, we're trying to do the same thing on the Illinois side. I keep in contact with Rock Island Fire because they're a transporting fire department also. And we communicate like, you know, what are you doing and what, you know, what are we going to do? And we try to do the same thing just so we're consistent for, you know, 2/3 of the Illinois Quad Cities. That's really kind of where we're at right now, unless there's other questions on that.
Thank you both. We do have an initial question here, and I was going to follow up with this as well. So for both Medic and Moline Fire, which I think Travis just spoke to, what is your PPE reserve at this time? Do you want to start with that, Linda?
Sure. We've been working with the Scott County Emergency Management Agency, and we can tell you that supplies that we've ordered back in January, we still don't have. So some concerns on the horizon could be, we could see some concerns with gloves. Gloves are something that we've always worn on every call, and those might be some future concerns. Travis talked about the N95s that, you know, our providers wear. We've had N95s for years, and we've always fitted our people for those, but the concerns are there's so many different varieties of N95s, and every time you get a different one, you have to fit test it. So, you know, we have 160 personnel here at Medics, so when we burn through 160 of them to fit test them, that's a lot of disposal right there. I'm very concerned about, I think it's a great idea to put a surgical mask on every patient or to ask every patient to wear a face covering. But for us, that's going to mean that we're going to have an additional burn rate of about 2,000 masks every month. That's going to be 24,000 masks a year for a surgical mask. Are we going to be able to get those? We do have a very good reserve of those in Scott County. I can't tell you how much that is. I know that the surgical mask is going to put some additional strains and implications on that right now. But PPE is something that is of highest priority right now for, I think, everybody in healthcare.
Did you want to add anything to that at all, Travis, besides what you had already provided?
No, I think Linda, added the additional that's right on. So I not much more to add to that.
Okay, thank you. We did have 2 questions that were submitted ahead of time, and this would be more for public health. So I will start with Ed on the first question, and then Nita as well. The first one says, since the White House has banned hospitals from reporting COVID-19 cases to the CDC, and the CDC is reporting that they no longer access hospital tracking data for COVID-19, will healthcare professionals and hospitals still report cases to their local health department? And how is this change going to affect us locally?
We don't anticipate any changes to how we receive positive test results. Hospitals, when they have labs and private labs, will continue to submit results to the Iowa Department of Public Health and will be notified through that state system. Hospitals do provide additional data on bed capacity, ventilators, and such things to the Iowa Department of Public Health, not directly to the local health department. So those activities will continue. It's a separate issue from the issue that you're discussing. That regards federal notifications.
Nita, do you want to add to that?
Sure. So in Illinois as well, COVID-19 cases will still be reported to the local health department because that's part of the Illinois infectious disease reporting law, and it's also how we do our contact tracing. So that starts the ball on contact tracing. This process is done primarily through the Illinois National Electronic Disease Surveillance System, which is also known as INEDS to us. There are about 80 infectious diseases that must be reported to public health. The most severe diseases, including COVID-19, require immediate reporting to the local health department, while others require notification within 24 hours or even other diseases some other time during the 7 days within the week. Public health is not part of the change of how hospitals are reporting COVID-19 patient and resource data. Hospitals never have been required to report bed and ventilator information to us directly.
Thank you. And then the last question that we received, what have the local health departments done to coordinate the opening of colleges like Augustana and St. Ambrose? Do you want to start for Scott County, Ed?
Sure. In Scott County, conversations like these have been taking place between our local colleges and universities to discuss COVID-19 in their diverse setting. Our department has assembled a team that will work closely with colleges and universities as they make their plans, and will also support them when a case of COVID-19 is identified. These institutions are working very hard to ensure they have robust plans in place, and we anticipate further guidance from the Iowa Department of Public Health, and we'll share this with the colleges and universities as soon as it's available.
And we'll open that up for you as well, Nita, for how you're helping on in Rock Island County for some of your colleges and universities.
Sure. We haven't talked to Augustana College recently, their leaders, but they are a private institution and they are not required to have reopening plans approved by the health department. However, they have been a great partner in the community, and we have collaborated before. They have consulted us on ideas and advice in the past. So we regularly host Augustana interns here in the public health office, and also our emergency preparedness program leads the Augustana unit of the Medical Reserve Corps for college students, and that also trains students at Augustana to help in public health emergencies. So when and if we have vaccine or medication to hand out, they will be helping us in the future with that endeavor as well.
Thank you. It doesn't look like we have any additional questions, so I'll go ahead and thank both Travis and Linda for joining us today. We appreciate you helping to express the stress that these types of high case numbers have on all parts of our system to be able to respond. So we appreciate that. Again, thank you to the media for joining us. We hope you'll share this information and again, stress all of those points that public health as well as the health system has been providing related to hand washing, wearing face covering, social distancing, and all of those important factors. So we'll continue to be in communication and let you know when we're ready for our next briefing. Thank you for joining us and have a great afternoon.